Namaste.
Namaskar and welcome to News Night. I'm Shubhendu Ghosh. While the COVID crisis rages on in the country, combined efforts to tackle the challenge is also underway. From ensuring steady oxygen supply to availability of crucial medication like remdesivir, it is being managed on war footing. New directions for home isolation have been announced as well. We'll focus on these guidelines in the show up ahead. Meanwhile, international aid to face the unprecedented COVID wave continues to arrive. All that and more. First, the top stories. Centre says there is sufficient stock of liquid oxygen in the country. Efforts on to tackle any shortage. Oxygen containers imported from abroad. Railways, Air Force working round the clock to deliver oxygen. Railways has delivered over 664 metric tons of oxygen so far. India imports over 4.5 lakh doses of remdesivir to meet the growing demand. Health Ministry cautions medicine to be used only on recommendation by doctor. New directions for home isolation announced. Prime Minister Narendra Modi leads Council of Ministers meet to discuss the second wave of COVID pandemic. PM emphasizes all stakeholders must work in coordination to deal with the crisis. Emphasis on COVID appropriate behavior. Over 3.86 lakh new COVID cases in India in the past 24 hours. Latest data shows 40% of cases concentrated across Maharashtra, Uttar Pradesh and Delhi. Health Ministry says containment zones crucial to break the chain of transmission. Vaccination drive continues across the country. Over 15 crore 22 lakh doses delivered so far. Vaccination for people of 18 years and above will begin on Saturday. Some states express inability to open new phase of jabs due to shortage of vaccines. International aid to manage COVID crisis in India continues. Help arrives from the US and UK. Japan announces aid of 300 oxygen concentrators and ventilators. Customs Department facilitates early clearances. Former Attorney General Solly Sorabji passes away after contracting COVID-19. President, Prime Minister express grief. Noted journalist Rohit Sardana also succumbs to COVID. Prime Minister condoles his demise. Government to celebrate birth centenary of iconic filmmaker Satyajit Ray. Celebrations planned in India and abroad. Satyajit Ray Lifetime Achievement Awards were announced earlier this year. Let's first get the updates on the COVID situation from across the states. Maharashtra government has decided to extend lockdown restrictions till 15th of May. Weekend lockdown has been announced in Gurgaon, 8 other Haryana districts amid COVID surge. Uttar Pradesh state government has increased the 2-day curfew to contain the rising cases. Meanwhile, vaccination drive continues across the country. Over 15 crore doses have been delivered so far. Vaccination for people of 18 years and above will begin on Saturday. Some states have expressed inability to open this new phase of vaccination due to shortage of vaccines.
Government of India has so far provided nearly 16.33 crore vaccine doses to states, union territories free of cost. More than 1 crore COVID vaccine doses are still available with the states or union territories to be administered. Nearly 20 lakh vaccine doses will be received in addition by the states, union territories within the next 3 days. On vaccination front, more than 2.45 crore beneficiaries have registered themselves on a CoWIN digital platform for phase 3 of the vaccination. On the other hand, the cumulative number of COVID-19 vaccine doses administered in the country has crossed 15.22 crore.
अब तक करीब 15 करोड़ के करीब डोजेस देश में फ्री जनवरी से देते हुए हम लोग आ रहे हैं। 50% जो देश की सप्लाईज हैं वह गवर्नमेंट ऑफ इंडिया द्वारा कंटिन्यूड फ्री वैक्सीनेशन थ्रू स्टेट एंड ड्यूटीज चलेंगी। इसके साथ ही स्टेट गवर्नमेंट वह अपनी कवरेज और पॉपुलेशन और प्राइस को डिटरमिन करते हुए कंट्रीब्यूट कर सकती हैं।
Meanwhile, Madhya Pradesh government has said that vaccination under phase 3 for people from 18 to 44 years of age will not begin from 1st of May. State Chief Minister Shivraj Singh Chauhan, while addressing doctors, nurses and pharmaceutical staff of the state through video conferencing, said that they had placed orders for vaccines but are not sure when they would get it.
1 तारीख से पहले 18 साल से ऊपर के नौजवानों को वैक्सीन लगाने का अभियान प्रारंभ होना था, लेकिन दोनों कंपनियों से संपर्क करने के बाद ये पता चला है कि 1 तारीख को वो हमें वैक्सीन के डोजेज दे नहीं पाएंगी।
Karnataka government has also announced that the third phase of COVID-19 vaccination for those in the age group of 18 to 44 years will not begin on 1st of May. Health and Medical Education Minister K. Sudhakar appealed to beneficiaries to refrain from visiting hospitals for vaccination from 1st of May.
We have made orders from the state government to Serum Institute at Pune for about more than 1 crore doses. But the official news is that they are still not prepared to give it to us from tomorrow as it was scheduled. So that is why we are requesting the people of Karnataka, especially those who are above 18 years up to 44 years, to refrain from going to the hospitals.
Rajasthan Health Minister Dr. Raghu Sharma said the inoculation drive against COVID-19 to cover those between 18 and 45 years will not be starting from 1st of May in the state. The state minister said Pune-based Serum Institute of India is providing 3 lakh doses of vaccines to Rajasthan. As a result, the state has decided to delay the commencement of vaccination drive for those above 18 years. However, the state government will prioritize vaccinations across worst affected cities based on availability.
अब इन 3 लाख वैक्सीन जो संभावित है आना, उसको हमने देखा है कि जो 9 शहर हैं जहां सबसे ज्यादा संक्रमण आज की तारीख में है, वहां इनको बांट के और वहां पहले 35 साल से 44 साल के एज ग्रुप के लोगों को वैक्सीनेट करें।
Maharashtra too is all set to begin phase 3 vaccinations in a phased manner. Current tranche of vaccines promised by SII and Bharat Biotech is not sufficient to service the third phase across the state.
State government and Chief Minister Uddhav Thackeray intend to start vaccination for 18 to 45 age group from 1st May on limited centers. We will expand this as soon as we have enough vaccines.
Vaccination for 18 to 45 years of age will not begin tomorrow in Goa. Government of Goa has placed an order for 5 lakh doses of COVID-19 vaccines for 18 to 45 age groups, but has not yet received adequate vaccine doses from the manufacturer. In a tweet message, Chief Minister Dr. Pramod Sawant requested people of 18 to 45 years of age group to not rush at vaccine centers. In Odisha also, vaccinations have been halted till Monday, awaiting delivery of stocks from vaccine manufacturers.
Even if we get the vaccine today, we are not going to conduct tomorrow. So at best we can start from Monday if we get the vaccine today. After getting the vaccine only we will clarify whether it will be done and when it will be done.
The third vaccination drive in Assam is set to start soon with proper planning. Mission Director, National Health Mission in the state, Dr. Lakshmanan, said phase 3 will begin once more vaccines are available.
The registration process has already started. Now they will become eligible for vaccination. The locations where they can get will be communicated to them through the portal itself, and accordingly the vaccine delivery will also start. Further, this vaccine which is to be given to the 1844 as per the allocations made by Government of India, the state government is fully engaged in procurement, distribution and delivery of vaccines. We hope that in a very sooner day we will be able to start
Maharashtra government has decided to extend lockdown restrictions till 15th of May amid massive surge in COVID-19 cases. Section 144 of the CRPC remains in force across Maharashtra, with only emergency services personnel allowed to use local train services in Mumbai as well as other public transport in the rest of the state. In view of the increasing cases of corona infection in UP, the state government has increased the 2-day curfew to 3 days as corona curfew has helped in reducing the prevalence of the infection. An extended weekend curfew from Friday 8 p.m. to Tuesday 7 a.m. will be in place. UP Chief Minister Yogi Adityanath visited COVID hospital being prepared by DRDO at Awadh Shilpgram.
मंगलवार प्रातः 7 बजे तक साप्ताहिक बंदी रहेगी। इस दौरान पूरे प्रदेश में ग्रामीण क्षेत्रों में, नगरीय क्षेत्रों में साफ सफाई, सैनिटाइजेशन का एग्रेसिवली कार्य किया जाएगा। उसके लिए पूरी टीमें बना दी गई हैं।
4-day lockdown began in Goa from Thursday night. Police personnel have been deployed for strict enforcement of lockdown. All essential services, including grocery stores, will be open during this period. State borders will be open. In partial modification to the earlier decision, government has allowed state transport buses for essential services staff with maximum of 50% capacity. In Jammu and Kashmir, 84-hour-long lockdown in 11 districts began yesterday evening due to spike in number of COVID cases. Corona curfew will last till 7 a.m. Monday, that is 3rd of May. However, Lieutenant Governor Manoj Sinha has said that during the curfew period, essential services will be exempted from the purview of lockdown. In Delhi, COVID care center run by Indo-Tibetan Border Police in South Delhi admitted about 400 patients since Monday. Facilities including medicines and food are being provided free of cost at these centers. Facility has a current capacity of 500 oxygen beds. Patients with worsening conditions are being referred to big hospitals. With Bureau Inputs, DD India.
And Centre has said there is sufficient stock of liquid oxygen in the country. Efforts are on to ensure and tackle any shortage. Oxygen containers have been imported from abroad as well. Railways and airports are working round the clock to deliver oxygen wherever it is required. Railways has delivered over 664 metric ton of oxygen so far. Defence forces are playing a key role in supporting the health infrastructure in the country. Home isolation, meanwhile, has emerged as a key to treating COVID and also lower the burdens on hospitals. Here's more. The fight against COVID pandemic continues across the country. Centre has taken several steps to meet the demand for oxygen in hospitals. In a press conference, Health Ministry informed that there is sufficient stock of liquid oxygen and efforts are on to ensure there is no shortage.
कई प्रयास किए जा रहे हैं इसकी और उत्पादन क्षमता को बढ़ाने के लिए। नए ऑक्सीजन के प्लांट शुरू किए गए हैं और जो पुराने हमारे ऑक्सीजन के प्लांट्स थे उनकी भी जो डेली प्रोडक्शन था उसको अथक प्रयास से बढ़ाया जा रहा है। साथ ही साथ जो इंडस्ट्रियल गैस मैन्युफैक्चरर्स थे उनको भी ये परमिशन दी गई है कि वो मेडिकल ऑक्सीजन का उत्पादन कर सकें।
Government is installing PSA plants at various locations and also importing liquid oxygen and containers from abroad.
इस समय की स्थिति को देखते हुए हर तरह के एफर्ट्स करना एक बहुत आवश्यक कार्य है। उसके तहत ही ऑक्सीजन का इंपोर्ट भी शुरू किया गया है। गवर्नमेंट की तरफ से 200 मैट्रिक टन ऑक्सीजन के प्लांट का ऑक्सीजन का ऑर्डर हमने सिंगापुर को प्लेस किया है। 1800 मैट्रिक टन का हमने आबू धाबी को प्लेस किया है और 1500 मैट्रिक टन अल्ट्रा प्योर गैसेस जो कि दूसरे देशों से इंपोर्ट करके हमें प्रोवाइड कराएगी उनको प्लेस भी किया गया है।
Meanwhile, Air Force, Railways and DRDO are working round the clock to cater to the regions where shortage of oxygen is reported. Till Thursday, Air Force took 23 flights to bring around 39 oxygen containers from abroad with a combined capacity of 670 metric ton. Within the country, 124 flights were undertaken to transport 87 containers of a total 1,798 metric ton capacity. Air Force is delivering containers to different parts of the country. It is also helping in bringing empty cryogenic oxygen containers from Bangkok, Singapore and Dubai. 3 containers from Singapore, 6 from Dubai reached Panagar. Besides, 3 containers arrived from Bangkok. Oxygen Express are running across the country to meet the growing demand. More such trains are planned for Haryana, Madhya Pradesh, Telangana and Uttar Pradesh. So far, Railways has delivered 664 metric tons of oxygen. Around 126 metric ton is on its way. DRDO is making large-size oxygen containers at hospitals. Sardar Patel COVID Care Center in Chhatarpur, Delhi is provided with 40 oxygen cylinders. DRDO also made available 40 cylinders to the Delhi government on Thursday. Meanwhile, Centre has released data to show the pattern of COVID pandemic in the past couple of weeks. Maharashtra has 21%, Uttar Pradesh has 10.4% and Delhi has 7.8% of the COVID cases. Together, they account for nearly 40% of the total cases in the country. In terms of casualty figures, 26.3%, 12.3% and 8.9% deaths have occurred in Maharashtra, Delhi and Chhattisgarh, accounting for nearly 48% of the total casualties. In the week ending 29th of April, Maharashtra continues to report highest average daily new cases. It is followed by Uttar Pradesh, Karnataka, Kerala, Delhi, Rajasthan, Chhattisgarh and Tamil Nadu, West Bengal and Gujarat. In the same period, Maharashtra leads the average daily new deaths as well, followed by Delhi, Uttar Pradesh, Chhattisgarh, Karnataka, Gujarat, Jharkhand, Punjab, Madhya Pradesh and Rajasthan. Health Ministry is coordinating efforts with states to contain the casualties.
अप्रैल के मंथ में हमारे देश में सडनली केसेस में वृद्धि भी आई है। इसी तरीके से अगर हम देखें कि किन स्टेट्स से कोऑर्डिनेट करते हुए डेथ्स के विषय में और उनके साथ काम करना है, तो हम पाते हैं कि जैसे कि अगर उत्तर प्रदेश और गुजरात से स्लाइटली हायर डेथ्स स्टार्टेड गेटिंग रिपोर्टेड विद इन 1 month पीरियड, 4 weeks पीरियड, इसी तरीके से दिल्ली में अब देश में दूसरे नंबर पर डेथ रिपोर्ट हो रही हैं। तो अगर हम देखें कि महाराष्ट्र, दिल्ली, यूपी, छत्तीसगढ़, कर्नाटका, गुजरात, झारखंड, पंजाब, मध्य प्रदेश और राजस्थान, यह वह स्टेट्स हैं जहां पर कि थोड़ी अधिक संख्या में डेथ रिपोर्ट हो रही हैं, जिसके चलते हुए हम उन स्टेट्स के साथ कोऑर्डिनेट कर रहे हैं और उन स्टेट्स के साथ क्लिनिकल मैनेजमेंट पर हमारा कंटिन्यूड फोकस बना हुआ है।
Health Ministry has advised strict measures like forming containment zones to break the chain of infections.
हमने स्टेट से यह भी रिक्वेस्ट की है कि जितने भी पेशेंट, जैसे कि आपने कुछ दिनों पहले भी यह विषय मीडिया द्वारा पूछा गया था कि कई हॉस्पिटल्स में सस्पेक्ट केसेस को वह एडमिट नहीं कर रहे हैं, तो हमने रीट्रेट किया कि हमारी क्लिनिकल मैनेजमेंट की जो टेक्निकल सपोर्ट गाइडलाइंस जो कि स्टेट्स को हमने इससे पहले भी पिछले साल भी प्रोवाइड की थी, उसके तहत कोविड सस्पेक्ट वार्ड भी बनाने चाहिए, जहां पर कि अगर कोई पेशेंट जिसका टेस्ट रिजल्ट किसी कारणवश नहीं आया है या डिलेड है, बट वो क्लिनिकल सिम्टम से कोविड एग्जिबिट करता है, तो आप उसको कोविड सस्पेक्ट वार्ड में एडमिट करके उसका ट्रीटमेंट शुरू करें।
New directions have been announced for home isolation and people are advised to follow the suggestions.
होम आइसोलेशन उन्हीं केसेस में किया जाए जहां घर के अंदर जो आदमी पॉजिटिव आया है उसके आइसोलेशन की व्यवस्था हो, उसके पास एक सेपरेट रूम अवेलेबल हो सके और उसके फैमिली मेंबर्स के लिए भी, क्योंकि वो क्वारंटाइन मोड में रहेंगे, वे हाई रिस्क कैटेगरी में रहेंगे एज ए कॉन्टैक्ट, उनके लिए भी अलग से रहने की व्यवस्था हो। अगर ऐसी व्यवस्था ना हो तो काइंडली स्टेट गवर्नमेंट से, डिस्ट्रिक्ट से कोऑर्डिनेट करते हुए आप फैसिलिटी क्वारंटाइन या फैसिलिटी आइसोलेशन की तैयारी करें।
होम आइसोलेशन कब डिसकंटिन्यू करनी चाहिए, ये भी एक बहुत ज़रूरी चीज़ है समझना, और इसको कहते हैं व्हेन विल द पेशेंट स्टैंड डिस्चार्ज्ड एंड एंड होम आइसोलेशन। कब हम ये कह सकते हैं कि अब आप अपने कमरे से बाहर आ सकते हैं। इसके लिए जो हमारी गाइडलाइंस हैं वो ये कहते हैं कि एटलीस्ट 10 days हो जाने चाहिए, जिससे आप पहले सिम्टम से और फ्रॉम डेट ऑफ सैम्पलिंग ऑफ एसिम्प्टोमेटिक केस। तो यानी कि अगर आप आज टेस्ट पॉजिटिव हुए, आपको कोई लक्षण नहीं है, तो आपको एटलीस्ट 10 दिन होम आइसोलेशन करने की जरूरत है। अगर कोई लक्षण है तो एटलीस्ट 3 दिन ऐसे होने चाहिए 10 दिन में, लास्ट 3 days, जब आपको कोई फीवर नहीं हुआ और कोई और सिम्टम नहीं है। तो अगर आपको 6 या 7वें दिन के बाद बुखार नहीं हुआ और 10 दिन हो जाते हैं, तो आप होम आइसोलेशन से बाहर आ सकते हैं।
Meanwhile, India has imported 4.5 lakh doses of remdesivir to meet the domestic demand. Government has also increased the production of the medicine in the country. By 27th April, production increased from 38 lakh doses per month to over 1 crore doses per month. Permission has been granted to Telangana for use of drones to transport vaccines. Defence forces are also playing an important role in supporting health infrastructure in the times of crisis. Navy on Thursday sent a 57-member medical team to Ahmedabad. The team will be deputed at COVID care hospitals formed with PM Cares Fund. Army cantonments across the country are extending medical support to the needy. all-round efforts are taking place in the country to tackle the unprecedented challenge of the second wave of the pandemic. With Nitendra Singh, Bureau Report, DD India. That brings us to the issue in focus this evening, COVID care at home, talking about ways of home isolation and the benefits of that. Two eminent guests are joining me in the program. Dr. N.N. Mathur, Director, Lady Hardinge Medical College, and Dr. Rana A.K. Singh, Director and Medical Superintendent, Atal Bihari Vajpayee Institute of Medical Sciences, and Dr. RML Hospital. Good evening and warm welcome to both of you. Dr. Mathur, if I can come to you first. We understand the importance of home isolation also in the context of the pressures on the hospital infrastructure, but how does an individual assess whether home isolation is required or one should head to the hospital?
So, the home isolation is usually acceptable in cases who are mildly symptomatic or asymptomatic, and in case the saturations are okay and the person has got mild symptoms, we usually prescribe home isolation. Because of we are overwhelmed with the serious patients in the hospitals. So the criterias have been laid down, keeping that thing in mind, that the hospital doesn't get overwhelmed with some patients who can be easily home isolated. And there are some guidelines for the home isolation, that the patient should have a separate room and some caregiver should be there to look after him. But home isolation for the mildly symptomatic patients who are maintaining the oxygen saturation is good enough.
Right, Dr. Mathur, just to sort of give out the accurate information, in terms of mild symptoms, how do we understand that in terms of fever and the degree to which patients can be treated and taken care of at home?
So the symptoms, the fever, which is if the fever is the only symptom and there is no saturation going down, then usually you are supposed to go and tell your doctor about it or consult the doctor. And if he finds okay, then usually he will home isolate you if that is the only symptom, that is just the fever. And if your saturations are maintained, then you will be closely followed and asked to maintain your make the record of the saturation. And as soon as it is required that you need to shift, you will be shifted.
Right. Dr. Rana Singh, given how infectious COVID-19 is, how different is caring for a COVID patient at home as compared to any other ailment?
You see, like when we are talking about caring for a COVID positive patients in home setting, like we're talking about the home isolation or home quarantine, we can use different words for it. This subset of care is advised and advocated for only those group of people who have tested COVID positive. Either they have no symptoms or they have got very mild symptoms, like some amount of fever, occasional cough. So these are the like symptoms. So that means the person is capable of taking care of himself or herself. That is the most important thing. Like we were talking about, that there should be a room in the house. It should have attached toilet. For the other members, there should be separate room and another toilet. So when somebody has tested positive and other members of the family are negative, so that means the other members will have to be protected from contracting the infection from the person who is infected. So this person has to be self-sufficient. That person should be capable of taking care of their daily needs. Suppose that, what I am saying is absolutely a perfect fit. But suppose the symptoms are still mild, and symptoms are still mild and the person has tested positive. And if that person requires little bit of support,
right,
then what, I mean, then the people, I mean, the family members, what they can do is, they must wear a N95 mask, and then they can give some support to the patient. That's the most important thing. When the family members are going close to that person, they should try and maintain, like that social distancing norms.
Right.
After, taking care, they must wash their hands properly, that hand sanitization we are talking about. Like in the hospital setting, the healthcare workers, they wear PPE kit and other gears. It will not be possible for the family members to take that kind of precautions. So basically, home isolation, home quarantine or home care is for those people who are taking care, who are capable of taking care of their needs.
Right. Dr. Mathur, in the context of home isolation, the guidelines that have come in, they seem to also give a lot of attention to the caregiver, as to the manner in which the caregiver should take care of his or her health. That the person should be specifically identified in the family who is the one who's going to give care, and also some medication has been prescribed, including HCQ. If you could tell us a little more about that, about the caregiver.
Yeah, the caregiver should maintain all the COVID norms very, very strictly. Should wear the N95 mask if possible, and otherwise 2 double-layer, 3-layer masks, and should do the hand hygiene as Dr. Saab just mentioned, and should also measure his or her temperature regularly, and should watch for any symptoms that he or she is getting in case that happens, and may be required to do the testing as soon as any symptoms come. So that home caregiver is very closely monitored. Some of the doctors do give some prophylactic medicines. Earlier we used to give hydroxychloroquine, which has been, which is not given by many these days, but that could be tried. And if the symptoms come, or if the person's, or if the symptoms don't come, and the RT-PCR for whatever reason has been done, turns out to be positive, then the patient can be put on ivermectin.
Right. Also, Dr. Mathur, we've seen in these days, as layperson, that the need for oxygen has become paramount in the treatment of a COVID-positive patient, some of them whose oxygen levels go down. When someone is being treated and cared for at home, how do we monitor that aspect, and is it important to also have that sort of a facility at home where even oxygen may be provided to the patient?
See, usually anybody who is home isolated has to monitor his oxygen saturation with the pulse oximeter, and that is supposed to be there with him or her, and any drop in the oxygen saturation below, say, 94 should be taken seriously, and the doctor should be consulted whether the patient needs to move to the hospital or not. Though there is quite a buffer between the desaturation, which is very serious, and this 94 figure. But it is taken into account that the patient will take little time to move to the hospital, get the bed and things like that. So there is a buffer. But giving the oxygen at home is not a very good idea, because the patient has to be monitored very, very closely, and if the patient desaturates very fast, people will not be able to manage it at home.
Right. In terms of dietary habits and isolation, Dr. Rana, what are the guidelines that that both the patient and the caregivers must follow? Also, in terms of comorbidities that the positive patient may have, what are the extra cautions that one must exercise, Dr. Rana?
I'll tell you, if I talk about how the body recovers from any illness or any sickness, That includes COVID also. Body recovers because of its own strength, and that strength comes from nutrition. So nutritional part will have to be taken care of. That is absolutely paramount. Then there are certain difficulties in between. What happens once somebody has contracted corona? If the person becomes becomes symptomatic, has got some amount of fever, their appetite goes down. They don't feel like eating. So that is the time when one should not worry about what I should eat, what I should not eat. One should eat whatever one feels like eating. That is very, very important, because your appetite is low. So most of the things you don't feel like eating. And then on top of that, if you want to eat something or feel like eating something, and if there is restriction, that means you are not eating at all. So whatever one feels like eating as per the taste of the individual, one should eat, because the nutrition has to be maintained. Another thing is that in the face of any sickness, the whole system of the body, is affected, and digestive system is also no exception. So when somebody is sick, somebody has contracted corona, then the digestive system also becomes relatively weaker. So one should eat diet which is easily digestible, khichdi, dalia, something which is overcooked practically, because then that is easily digestible. Besides that, like if somebody has got some comorbidity, like if somebody is diabetic, somebody has got hypertension, somebody has got heart ailment, then all these people are on medications for all these, illnesses. And they have been given dietary advice by their previous clinicians who were treating them. So in that case, all these patients must continue the medications for control of the pre-existing disease, say diabetes, say hypertension, say thyroid, say heart disease. So they must continue the medications, and they also must follow the dietary advice which was given to them by their clinicians beforehand. But nutrition is an absolute must. Now,
Right.
I'm going to go a bit forward. Like somebody is a diabetic. Normally, clinicians would advise them to take less of carbohydrate diet. As I said, that the appetite of these individuals will be less. So if they feel like taking carbohydrate, it's a good idea to continue to take carbohydrate and neutralize the blood sugar with the medications. Because, some amount of rise in blood sugar or some amount of fall can always be titrated by doctors, and the blood sugar level can be brought to normal. So one way or the other, because the appetite will be low, so they must eat whatever they feel like eating. Do not impose unnecessary dietary restrictions.
Right. Dr. Mathur, we've just shared earlier in the program the manner in which India has ramped up the both production and import of crucial medicine like remdesivir. If you could give us an insight, sir, in the manner in which it has been helpful in the fight against COVID-19. At the same time, how important is it to take it or think of taking it only after recommendation by a medical expert?
Yeah, the remdesivir has to be given only when it is actually required. Its use is very limited, actually. Most of the time it is not indicated. There is one small window where it can be indicated, and then again it is not indicated. And it has been emphasized again and again that remdesivir is no sort of a magic drug. Even if it is not there, it will not ultimately change whether the person will live or not live. Because it doesn't change the death rate. And this has been emphasized so many times in different forums by the Government of India also. And it is our still the same view we have till now. And but wherever it is indicated, very small window, the drug should be given,
Right.
and there should not be any, hoarding of this drug, because it is not a magic drug at all. So unnecessarily people have, it appears in the papers that some people have got hold of that medicine and kept it. That should not happen, because then it will not be available for small group of people who actually need it. Others don't even need it.
Right. And so your final thoughts really, Dr. Mathur, given that there's so much anxiety and panic also around this COVID pandemic, how possible do you see, and in terms of also data, that home isolation does help people recover back to health?
The home isolation does help and people recover. Most of the people will be home isolated and they will recover. So that will be the majority group who will recover with the home isolation, and that should be that will be the story in most of the instances. Only very few people will be requiring the admission to the hospital, and but most of the people will recover with the home isolation.
Right. And Dr. Rana, your final thoughts, even while home isolation is being practiced, how crucial is it to stay in touch with the medical expert through telemedicine or other ways?
I am telling you, if somebody is home isolation, in which group of people it should be advocated or advised, I have already elaborated during my initial part of the talk. Most important thing for the people who are in home isolation, there should be a definite medical backup available for them in case they need it. Because if somebody is in home isolation and no symptom, very mild symptom, but suppose the symptoms exaggerate, they get, like very high, like fever, which is not coming down even with the paracetamol tablet. If they have got incessant cough, they're coughing continuously, violently, they're short of breath, and that ordinary tool which has become a household tool is that pulse oximeter. If the person has got a pulse oximeter in the house, once or twice or 3 times a day, like just putting it over the finger and getting the oxygen level. So if the fever goes up, not coming down with, like ordinary medication like paracetamol, if incessant cough, shortness of breath,
right,
pulse, the oxygen saturation going down, that is the time one should not make careless delay in reaching to the hospital. And they must, that's the time when the warning signs appear. That is the time, if you go to the hospital, if you get the treatment from the doctors as per your requirement, it's possible that the disease can get aborted, like at this point of time, without even getting hospitalized. If this window is lost, that when you can still, become better with the medications, if this window is lost, then you will need to be hospitalized, and then, you will require a hospital care. So a hospital backup option must be there, like for all the people who are home quarantined. So, that is absolutely paramount.
Right there, Dr. Mathur, Dr. Singh, thanks very much for joining us in the program and sharing those insights.
Thank you so much.
And international support and aid continues to arrive in India amidst the worst pandemic wave facing the country. United States has pledged to send over 100 million worth of supplies to India as COVID infections surge. That's in dollars. The deliveries have also started. Japan has announced it will provide some 300 oxygen concentrators, 300 ventilators to India. United Kingdom has sent third shipment containing 280 oxygen concentrators. Meanwhile, 2 lakh doses of Sputnik Russian vaccine will be available in the country in the early part of May. Here's more. International community continues to extend helping hand to counter the disastrous second wave of COVID-19 in India. Around 40 countries, including the US, Russia, France and the United Kingdom, have pledged their support. Many are already rushing critical emergency supplies.
इस समय की स्थिति को देखते हुए हर तरह के एफर्ट्स करना एक बहुत आवश्यक कार्य है। उसके तहत ही ऑक्सीजन का इंपोर्ट भी शुरू किया गया है। गवर्नमेंट की तरफ से 200 मेट्रिक टन ऑक्सीजन के प्लांट का ऑक्सीजन का ऑर्डर हमने सिंगापुर को प्लेस किया है। 1800 मैट्रिक टन का हमने आबू धाबी को प्लेस किया है और 1500 मैट्रिक टन अल्ट्रा प्योर गैसेस जो कि दूसरे देशों से इंपोर्ट करके हमें प्रोवाइड कराएगी, उनको प्लेस भी किया गया है।
US has pledged to send over $100 million worth of supplies to India as COVID infection surge. Deliveries have also started. 2 US Air Force C-5M Super Galaxy and C-17 Globemaster 3 arrived on Friday carrying oxygen cylinders or regulators, rapid diagnostic kits, N95 masks and pulse oximeters. Delhi Customs facilitated swift clearance of the COVID material received from the US. The supplies, which will continue into next week, include 1,100 oxygen cylinders, 1,700 oxygen concentrators, 15 million N95 masks and 1 million rapid diagnostic tests.
Reflecting the United States' solidarity with India as it battles a new wave of COVID-19 cases, the United States is delivering supplies worth more than $100 million in the coming days to provide urgent relief to our partners in India. In addition, U.S. state governments, private companies, non-governmental organizations, and thousands of Americans from across the country have mobilized to deliver vital oxygen, related equipment, and essential supplies for Indian hospitals to support frontline healthcare workers and the people of India most affected during this current outbreak. Just as India sent assistance to the United States when our hospitals were strained early in the pandemic, the United States is determined to help India.
1.5 to 2 lakh Sputnik Russian vaccine will be available in India in early part of May. Another 5 million doses are expected by June.
The Gamaleya Institute has clarified that the Sputnik vaccine is capable of handling the mutations that have taken place in India. We expect, say, between 150,000 and 200,000 ready-made vaccines to be available very quickly in the early part of May, but this will be increased definitely by the middle and the later part of May, and perhaps by the May itself, the total Sputnik numbers will be probably more than 3 million.
Japan has announced it will provide 300 oxygen concentrators and 300 ventilators to India in response to the current surge of COVID infections in the country. A statement said Japan stands with India, our friend and partner, in her efforts to fight COVID pandemic. Through this additional emergency assistance, Japan will continue to extend further support promptly in order to contain the COVID situation. Meanwhile, United Kingdom has sent third shipment containing 280 oxygen concentrators that arrived in early morning of Friday. Air cargo import, Delhi Customs facilitated swift clearance of the consignment. Also, consignment containing 80 oxygen concentrators and 75 oxygen cylinders from Romania arrived in India. Further, a shipment containing 700 units of oxygen concentrators and 365 ventilators arrived from Ireland as well. India also got coronavirus aid from UAE and Thailand late on Thursday night that was airlifted from their capital cities earlier. UAE sent the supplies in their own aircraft carrying some 157 ventilators, 480 BiPAPs and other medical supplies. Countries are sending hundreds of oxygen concentrators, respirators and large quantities of liquid oxygen to help ease the situation in India. The surge might have overwhelmed the health infrastructure in India, but the efforts from the centre and the states and a helping hand from friendly nations have scripted a spirited response to the challenge. Bureau Report, DD India. And the Council of Ministers met to discuss the situation arising out of second wave of COVID-19 in the country. The Council of Ministers meeting noted that the present pandemic crisis is once-in-a-century crisis and has thrown a big challenge for the world. The meeting, held through video conferencing, was chaired by Prime Minister Narendra Modi. PM Modi said that all arms of the government are working unitedly and rapidly to deal with the situation. He also urged ministers to stay in touch with people of their respective regions, help them and keep getting their feedback. PM stressed upon the need to ensure that issues at the local level are promptly identified and addressed. The Council of Ministers also stressed on the importance of COVID-appropriate behaviour, that is, wearing a mask, keeping physical distancing of about 6 feet and washing hands frequently. The Council also reiterated that the participation of society is a key aspect to accomplish the gigantic task ahead and expressed confidence that the country will rise to the occasion and defeat the virus. The efforts by central government in coordination with the states towards building up infrastructure in the form of ramping up hospital beds, PSA oxygen facilities, resolving issues in production, storage and transport of oxygen, tackling matters relating to availability of essential medicines were briefed. The support measures to the vulnerable population in the form of provision of food grains and financial support to Jan Dhan account holders were also pointed out. And Prime Minister Narendra Modi chaired a meeting to review the functioning of different empowered groups through video conferencing. The empowered group on economic and welfare measure made a presentation to Prime Minister on steps taken such as extension of PM Garib Kalyan Anna Yojana, portability enabled due to One Nation, One Ration Card initiative that has benefited many people. Insurance scheme for frontline health workers has been extended for another 6 months. PM directed the central government to work in close coordination with the states to ensure that poor get the benefits of free food grain without any issues. PM also said that steps should be taken to expedite the settlement of pending insurance claims so that dependents of the deceased are able to avail benefits in time. Empowered group on issues relating to facilitating supply chain and logistics management gave a presentation on various advisories related to measures to be taken to contain the pandemic. PM instructed officials to plan holistically to ensure seamless movement of goods so that supply chain disruptions are avoided. The empowered group on coordinating with private sector, NGOs, international organizations brief PM on how government is working in active partnership with the private sector, NGOs and international organizations. PM asked officials to explore how volunteers from civil society can help reduce pressure on healthcare sector by taking on non-specialized tasks. NGOs can help to establish and maintain lines of communication between patients, their dependents and healthcare personnel. Ex-servicemen could be encouraged to handle call centers for communicating with people under home quarantine. And Union Finance Ministry has decided to provide an additional amount of up to Rs 15,000 crores to states as interest-free 50-year loan for spending on capital projects. The states will get Rs 5,000 crore for asset monetization, disinvestment. Details have been shared as part of guidelines on the scheme of financial assistance to states for capital expenditure for 2021-22. And let's now get a quick roundup of more news and updates from across the country. The bench of Supreme Court Justice Chandrachud Singh has sought detailed report from Centre on issues regarding supply of oxygen and necessary medicines to corona patients. Supreme Court has advised the government in view of the COVID crisis to allow local manufacturers to produce remdesivir and other life-saving drugs under Section 92 of patent law. To ensure availability of the central government must procure these on the lines of national immunization policy and distribute further to the states. Also, mortuary workers should be brought under consideration for vaccination. The Supreme Court also warned state governments and police against clamping down on the spread of information or calls for help through social media from citizens affected by COVID-19. Bench headed by Justice Chandrachud said any move by any state to punish citizens who take to the social media to seek help for oxygen cylinders, COVID-19 drugs, beds, hospitalization amid a rampaging second wave would attract contempt of court action. The Supreme Court has issued notice to Uttar Pradesh government and State Election Commission on the petition to hold counting of votes for the state's Panchayat elections. The court to hear the plea on Saturday morning at 10:30. Petitioner had appealed to the stay the vote count post-Panchayat elections in view of the surging COVID cases. Former Attorney General of India and famous legal luminary Zoli Sorabji passed away on Friday at the age of 91 from COVID-19. President Ramnath Kovind, Prime Minister Narendra Modi condoled the death of the luminary. Sorabji was associated with the field of law for 7 decades and was decorated with Padma Vibhushan Award in 2002. Senior journalist and anchor Rohit Sardana passed away from corona. President Ramnath Kovind, Prime Minister Narendra Modi have expressed grief on the demise of Rohit Sardana. PM tweeted and said, Rohit Sardana left us too soon. Full of energy, passionate about India's progress and a kind-hearted soul, Rohit will be missed by many people. His untimely demise has left a huge void in the media world. Condolences to his family, friends and admirers. Lieutenant Governor of Delhi, Anil Baijal, has tested positive for coronavirus. The Lieutenant Governor tweeted to inform that he has mild symptoms of corona and has undergone self-isolation. He requested everyone who has been in his contact in the past few days to get themselves tested. He will monitor work from home. In Amritsar, Nagar Kirtan was organized from Sri Akal Takht Sahib to Guru Ka Mahal on Friday on the occasion of 400th Prakash Parva celebrations for the 9th Sikh Guru, Sri Guru Tegh Bahadur. Earlier on Thursday, celebrations began from Guru Ka Mahal, which is the birthplace of Guru Tegh Bahadur. In homage to legendary filmmaker Satyajit Ray, Ministry of Information and Broadcasting will organize year-long centenary celebrations of late Satyajit Ray across India and abroad. As part of these celebrations, media units of Ministry of Information and Broadcasting, Directorate of Film Festivals, Film Division, NFDC, NFAI and Satyajit Ray Film and Television Institute, Kolkata, are planning a series of activities. Other ministries' departments, including Ministry of External Affairs, Ministry of Culture, will also be playing an active role. However, in view of the pandemic situation, the celebrations will be held in hybrid mode, digital and physical, both during the year. The recognition of the author's legacy, Satyajit Ray Lifetime Achievement Award for Excellence in Cinema, had been instituted from this year to be given at the International Film Festival of India every year, starting from this year. The award comprises cash prize of Rs 10 lakh and a certificate, shawl, along with a silver peacock medal and a scroll. In some international news and updates, French government spokesman Gabriel Attal said President Emmanuel Macron upheld his promises by announcing a detailed exit strategy out of country's lockdown, while some disputed the decision, citing high COVID-19 figures in France. On Thursday, Macron announced in an interview with the country's regional papers a four-phase plan for unwinding France's month-long stay-at-home order. The plan envisages the nightly curfew being pushed back to 2100 hours from 1900 hours from May 19th to 2300 hours from June 9th, before being scrapped completely by June 30th. Museums, cinemas, theatres will also be allowed to reopen on May 19th. Foreign tourists with health pass will be allowed to visit France again from June 9 onwards. A flash mob protest has taken place in Yangon as demonstrators continue to oppose the return of Myanmar military rule. Protesters took to the streets despite the heavy rains, chanting and carrying a banner. Security forces killed at least 759 protesters since the coup took place. The Assistance Association for Political Prisoners activist group have given that data. Dozens have been killed, scores injured and some 10,000 people evacuated following intense clashes over a water dispute on a disputed Kyrgyzstan-Tajikistan border. Clashes began on Wednesday when people from both sides hurled stones at each other after surveillance cameras were installed at the water facility. A truce and troop pullback were agreed upon. However, shooting appeared to continue. Russian Defense Ministry released footage of warships launching rockets at drills in Black Sea at military drills. The drills were conducted during raised tensions between Russia and the West over Russian military buildup near Ukrainian border. Kiev and Moscow have traded blame for the rising clashes in Donbass, where Ukrainian troops have battled Russian-backed forces in a conflict that Ukraine says has killed some 14,000 people since 2014. Israeli Prime Minister Benjamin Netanyahu has declared that the country will observe a national day of mourning on Sunday for the victims of Mount Meron. At least 45 people were crushed to death overnight on Friday at an overcrowded religious festival, with some trample victims going unnoticed until the PA system sounded an appeal to disperse. And as we conclude this edition of Newsnight, just a gentle reminder to get you all the authentic and clear information on the pandemic from our medical experts. We bring to you multiple episodes of our special program, Doctors Speak, at different times during the day. Here's the information. I'll take your leave. Namaskar.